Joining us today is Bridgette McGivern, CEO of Community Health and Dental Care. Bridgette, thanks for joining us.
Thanks for having me.
So let's talk about the mission of Community Health and Dental Care.
Our mission's simple. We are here to serve everybody. If you make low income or if you make six figures, our health centers, we have 5 locations, and we're there for everybody no matter what their needs are.
Wonderful. What is an integrated visit?
An integrated visit is, number one, everybody's always struggling for time, not enough time in the world. And what we try to do is if you come in, kind of think of it like a spa la la day. You get your medical exam, and then you can get your dental exam, and then you can get your vision exam, all in one visit. And that way, not having to have people come back, transportation or barriers. If you have a pediatric visit and a child flunks its vision exam, we can walk them right down and get their vision checked. It's having everything under one roof.
I love that, because
Yes.
it is hard sometimes to get off work, to go to all these different places. In addition to convenience, because it sounds very convenient, what are the advantages in coordinated patient care and having so many different services in one place?
Again, I just feel like if you're taking time off work, it's a struggle for parents working 2 jobs. Grandparents are helping out. People struggle with transportation. We offer free transportation. It's just really to try to get you to take care of yourself, do your preventive checks, have all your screenings, and any assistance is needed with translation. We have translation support. Just trying to get everyone to come in to take care of themselves is our mission.
And that's it. A lot of people push this off.
Yes.
They said, I'd rather, I want to take care of my grandkids, or I'm not going to, the mom not taking care of herself when she needs to.
Exactly.
How do you go about collecting so many different specialists, under one roof?
What we end up doing as a health center is we look at the needs in the community, so we don't just decide this is what we're going to look for and, start. We really study the community that we're serving, and we assess what those needs are. If people need it like, MAT services, medication assisted treatment, there's an opioid epidemic going around. Back in 2016, we added that. We knew that service was needed because many people were struggling with that disease. But on top of that, we have behavioral health, and we have other service lines that people may have never entered because they were having such an opioid epidemic. So it's depending on the needs of the community that you serve, really is how we structure the organization.
So someone might come in, let's say, for a medical visit or a dental visit, but then you have these other specialists that are there where they might be having a problem with their mental health.
Correct.
And you can say, well, here, we have somebody if you would like to talk to them.
Exactly. Providers are usually really busy. They have to keep moving on, your medical providers, and at Community Health and Dental Care, we have a whole care team. So you would have a behavioral health support coming in, they would do screenings, there's assistance everywhere. That's what's neat about going to a health center versus your traditional practices, because we really have a whole care team to take care of the whole person.
Bridgette, that's wonderful.
Yes.
Thank you so much for joining us on Community Connection.
Thank you.